Hey everyone, my name is Daniel Huff, and the topic I'm covering is the insurance exchange market, specifically from the federal level. I know that's quite a mouthful, so Federally Facilitated Exchange, FFE, that's what I'm going to use from now on for the rest of this time. While I'm going to get into the intro and everything, I'm just going to state up front. Basically, what this topic is about is the marketplace that the government made to compare different insurance plans. So a consumer using healthcare.gov, they're using the FFE. Now, getting into the intro, most of you know from your papers, the Affordable Care Act was signed March 23rd, 2010. It included lots of provisions for this health insurance exchange. This is in sections 1311 to 1313 and 1321 to 1324. Because this is such a central part of the ACA, there are probably many other sections that dealt with it, but those are the main ones. This officially launched on October 1st, 2013 through the healthcare.gov website, but the official deadline was March 31st, 2014. Defining the problem, many of you probably know from our class. In 2008, 1 in 7 Americans was uninsured. And this is a uniquely American problem. Most other developed countries have universal healthcare systems, so 99+% of their population is covered. On top of that, we're spending significantly more than others. In 2008, 16.3% of our GDP went to healthcare, where for them it was about 9.2%. And on top of that, every year our healthcare spending grows significantly more than theirs. And looking at history, this has proved true from the 80s to present. And so it's no surprise then that in 2008, 9 out of 10 healthcare leaders and 82% of the public said, we need to fix this. There needs to be a major overhaul. As you probably, again, from your papers probably know, throughout history, there have been many presidents who have tried to address this issue. Truman was the first one to propose, as far as I know, universal healthcare. It failed under him. LBJ expanded the government's role in healthcare through Medicare and Medicaid. We have HIPAA and CHIP due to Bill Clinton. Medicare Part D was expanded under George W. Bush. And then Carter and Clinton also sought universal healthcare, but they were defeated in the political arena. Suffice to say, it's a very contentious issue that's been debated for a long time, but it's a very difficult. It's difficult to get any legislation through. So this is the history Obama had behind him whenever he came into office in 2009. We have this poor quality health system that's costly, highly partisan to touch, and yet it was the foundation of his campaign. He said, I will reform healthcare. He won with a majority of the American public, so he had a political mandate to address it. To that end, the Affordable Care Act had 3 goals: expand coverage, slow healthcare spending, and improve clinical quality. So looking at the FFEs, what is that? Let me discuss that a little bit more. The FFE is just a marketplace where consumers can compare different insurance plans. So the government talks to all these different insurers and says, give us your plans, we'll certify that they're at a certain quality level, they're good enough, and we'll put it on this marketplace, which is now healthcare.gov. The idea behind this is that it would be very transparent, so consumers could look at it very closely and say, plan A costs this much, plan B costs this much. And they could look at the cost benefit for each. And in this way, it would promote the market itself would help drive prices down because there would be competition between these different insurers due to so much transparency. So this was the hope of it. The benefit of the FFE is that it's also a one-stop shop for consumers. You go there, you enter your income information, your social security number, some other background information, and it works with Medicare, Medicaid, CHIP, and the Department of the Treasury to say whether you're eligible for any of those services or any of the subsidies that were part of the ACA. So that was the hope. That was the ideal goal for the FFE. Looking at it, we see that from 2010 to 2016, the uninsured rate dropped dramatically from 18.2% to 10.3%. There's arguments that if all states expanded coverage, that another 3.7 million people would be insured. People are significantly less likely to say that they can't afford health or they can't afford insurance, and so many would say that's a pretty solid population benefit. Looking at how much this actually costs is very contentious, and so I'm going to use the Congressional Budget Office's numbers. They originally said that this would cost about 460 billion, that's very different, $460 billion to establish the exchange and include the tax credits, the subsidies with it. This was later revised to about $808 billion. So somewhere between $460 to $800 billion is how much this has cost. How this has affected individuals is also confusing. Out-of-pocket spending has decreased by about 12%, but premiums have increased by about 12%. What's more, healthcare spending has decreased for Medicaid eligible populations, while it's gone up for middle class and wealthier. So in some ways you could say the cost of insurance has gone down for those who are poor, and it has increased for the rest of the population. Looking at how cost containment's been working, the Urban Institute estimated that the ACA is projected to lower healthcare costs by about $2.6 trillion between 2014 and 2019. So $2.6 trillion. Our healthcare growth is between 3 and 5%. And so this is significantly better than what it used to be, where it was at 5 to 12%. And that's looking at it from the 80s to when the ACA was involved. So people would argue that it has been effective at controlling costs, but it has not solved all of our issues. Who runs this market? It's largely under the purview of the Department of Health and Human Services. The subdivision of it, Centers for Medicare and Medicaid Services, is intimately involved with it, since they're involved with those services as well as CHIP. Furthermore, since small businesses can shop on this, the Department of Labor is involved, and because there's so much money involved with the subsidies, the Department of Treasury is involved. But big picture, Department of Health and Human Services is responsible for running this. How has this affected all the different stakeholders? For insurers, it's been a challenging transition. Their business model was oriented towards the self-insured market, and so they're still adjusting to this new one. So there is a lot of turnover in different insurers' involvement in the market. There are many states where there's only a single insurer on the market, which means it's not functioning how it's supposed to. That's monopoly, not competition driving prices down. Healthcare providers say that their workload has increased. They're seeing more people, and yet they feel like they have less time to deal with individuals because their administrative work has gone up. Interestingly enough, their thoughts on the ACA largely depend on their political ideology. So if they're a Democrat, they feel positively about a lot of this. If they're a Republican, they feel very negatively about this. Looking at the government's role as a stakeholder, there are a lot of different bureaucracies involved, and so it's been very challenging for them. The Department of Health and Human Services is now having to run healthcare.gov, which is the major FFE portal site. And that's not their original intention. They've been very focused on Medicare and Medicaid for a long period of time, and so this is a huge shift where they're having to learn lots of technology. So it's been an adjustment for them. Now, let's look at the benefits of this specific policy, evaluate it. Having a centralized market, as I mentioned before, allows for transparency and competition. And this is not ideal for most insurance companies who might compete better in an ambiguous market, but the idea is this helps consumers. Looking at FFE over the state-based market, they can enroll someone for about $650 compared to $1,500 for the state-based market. So the federal insurance market, significantly better than the state-based market. The problem with the FFE is that it's so complicated. It's really hard to use healthcare.gov, and you have to enter in a lot of information before we can actually compare plans. And so this is a detriment to the transparency and competition. On top of that, healthcare.gov crashed immediately in 2013 after it was launched. And because it's so central to the ACA, that the ACA, I would argue, lives and dies by how well this market forms. Is there an alternative to this? The only real alternative would be go off exchange. There are arguments to be made that insurers have bigger profit margins based on this, and with a bigger profit margin, the market could be healthier, and some would argue that this could help consumers. Um, from an administrative standpoint, this would help the government immensely because they've invested at least $300 million into the just healthcare.gov, and we talked about the billions of dollars. And it's a challenging process for them. So not having them run the FFE would be immensely helpful for them. But this is a highly contentious issue.